We go.
Good evening. Welcome to our NAACP Anne Arundel County Health Zoom meeting. This is Tuesday, March the 10th, 2026, and our meeting is going to last for an hour. Um, so first, I want to welcome President Wadi, who's on our screen. And said I'll be on the screen in a little bit, still traveling. And welcome our guest, Allison Flores, Director of Office of Multicultural Affairs for Anne Arundel County. Um, Allison, welcome.
Thank you. Thank you so much for the invitation.
I'm going to do a brief intro here. Um, and so Allison came to Anne Arundel County after serving as deputy director for the PG County Office of Community Relations. She's a professional in communications and government affairs. She previously served as Latino Affairs liaison for PG County exec, and is responsible for engaging with the Latino community and stakeholders there. And that's her background. Also, I found very gratifying that Allison has a sociology degree from Catholic University of America, where my daughter majored in art and I think literature. I think is the two majors, um, but a fine school. And do you have any opening words for us?
You asking if I had any opening words? I'm sorry, I couldn't.
Okay, I wanted to invite Allison to open first, but either one of you is fine.
Allison, I'm sorry. I think your audio went out real quick. I couldn't hear you. I'm
Oh,
sorry.
sorry.
I defer to the president too if you want to say any opening words, and then I can go into the presentation.
Well, I met Allison a couple of years ago at I think it was a few of the many awards, and she was reading the names, presenting the awards, and doing a wonderful job. And it was my first time ever uh, being introduced to her, and I met her several times since then through various county events. And I know that the organization, the Office of Multicultural Affairs, is doing some really great work throughout the county and is performing a much needed service to make sure that we're bringing communities together and not we're building bridges, not building walls, which is what um, we have been subjected to over these last few years. And so her job is a very important one and a very necessary one as well. And I hear you need to share. Need to share your screen? Okay, so let me
Yes.
see if I can let you share your screen. Okay, awesome. Thank you. You got it?
Yes.
Okay, good.
I usually like to do a presentation that way. It's feels more engaging.
I
Um,
understand.
All right. Well,
Thank
thank
you.
you so much. Thank you for the invitation to speak to your members and to share a little bit about what we're doing in the Office of Multicultural Affairs. I am going to speak about mostly the Family Protection Initiative because that's what our office has been really focused on over this past year. But I did want to give an overview of just some of the initiatives we have in the office. So we have our office was created 2 years ago in January 2024. We're one of the newer offices within the county exec shop. Um, we're small but mighty. And so we've tried to be really active and try to engage with as many people as possible. These are a couple of our initiatives here. Our community building mini grant is really designed to elevate how diverse Anne Arundel County is and provide both residents and visitors an opportunity to experience different cultures and connect through art or festivals. This last grant cycle, we awarded, I believe, over 26 nonprofits receive funds, and they're small grants, but they're really intended to build community and activate different parts of the county. The second initiative that we had is certified welcoming, which is really similar to what AARP does to see how age-friendly a jurisdiction is. This is essentially how immigrant-friendly the county is. And when we think about it being immigrant-friendly, the more accessible government is, makes it more accessible for everyone as well to navigate what sometimes can be a very challenging thing to navigate government. We also do a lot of community outreach. In 2025, we attended over 100 community events and engaged with different outreach efforts. 100's quite a bit for us. We are, for the past 6 months, it's just been me in the office, but we're typically an office of two. And so we try to do as much as possible and really lean on our partners to get things done, because you can't do anything by yourself and certainly couldn't do any of this work by yourselves. And then what I'll be speaking more about today is our Family Protection Initiative. But before we get into more about what this initiative is, I'm going to ask folks if for a moment you could imagine being a young mom and receiving threats from a local gang. Uh, at some point, these start to escalate to a physical attack. And now, because you are a victim of a crime, you're receiving threats that if you report the crime, you will be killed. So you move to a different town, but they find you. And now they're also threatening your young children. So you make the tough decision to make the journey to the border to seek asylum. The journey itself possesses many dangers and no guarantees. But what you do know is if you stay, that's a guaranteed death. You make it to the US and stay with loved ones. You start working to rebuild your life. You start the application process for asylum and are granted a work permit. And for many years, as a single mother, you provide for your children working different jobs, and you're able to start rebuilding your life and supporting your kids. Then one day, while you're working as an Uber Eats driver, you go to drop off an order at the Fort Meade base. And when you approach the base, the guard at the front asks you if you are a citizen, yes or no. And you tell the officer that you're not, but that you have a work permit, and you're a contractor with Uber Eats, which requires you to have some type of legal status. But the guard ignores you and calls ICE. ICE then shows up and detains and arrests you. You are then moved to the Baltimore field office, and you spend about 4 or 5 days here in a room with about 40 other people and one toilet in the middle of the room. You are then transferred to a larger facility, and it is at this point that you're able to call home. Your oldest daughter, who is 19 years old, has now taken on the responsibility of taking care of her two younger siblings. And she is sharing with you that your youngest, who has autism, is having a very difficult time understanding why you're not coming home. She's afraid, you're afraid, and you don't know what the future holds. Thankfully, a group of people back home hear about your case and start helping your family. These are residents that you don't know and that don't know you, but they ensure that your children have a meal to eat while you're gone. And through churches, they're able to connect you to an attorney, and you're able to post bond. And they connect you to a group out in Denver that is able to purchase your bus ticket so that you can come back home. And when you come back home, you're so grateful to see your children again. But it's in that moment that you realize that you have not showered since the day you were detained about 5 to 6 weeks ago, and that you came back in the same clothing that you were detained in 5 to 6 weeks ago. Now, you and your children have night terrors. You can't even open the blinds of your home because you're afraid. You don't have a job. You don't know how you're going to pay for rent. You don't know how you're going to pay for an attorney to continue pursuing your legal case. Um, and I've shared that the story with different folks. This is not a hypothetical scenario. This is the life. This is the current life of a resident of Anne Arundel County right now. And I share this for two main reasons. One, it's important to keep in mind who is being impacted by the current indiscriminate immigration enforcement that we're seeing across the country. And then two, it really demonstrates how ordinary people can help each other in a time of need. Um, and so over the next couple of minutes, I'll be just sharing a little bit about our work, what we're trying to work towards, a snapshot of the immigration landscape here in the county, and how we can all get involved and help. And then happy to answer questions at the end, or any follow-up questions afterwards via email as well. Um, the Family Protection Initiative is really based off of community concerns that came up starting November 2024, December 2024. We started hearing from different groups that were really concerned about the changes that were anticipated in January 2025. And so we really approached this through an emergency management lens. So, same way that the county prepares for hurricane season, we've tried to prepare for a potential crisis in the same way by encouraging families to get informed and also providing those crisis support services. And I do apologize if you hear my dog in the background. She's just having, I don't know what's going on over there. Our Family Protection Initiative has three key components, and I'll go into each one briefly. The first is education and preparedness. A big part of this is informing families of the importance of family preparedness, things like power of attorney, standby guardianship. Um, and these are difficult things to talk about and for a parent to kind of think about is if something happens to you, who would you leave your kids with? Who do you trust enough to take on that responsibility? But what we have seen is that once someone is detained, if they don't have that paperwork already completed, it becomes very difficult to designate a different guardian for your child or even get access to your bank account once you've been deported. And so we partnered with a variety of just different churches. So through January 2025 through April 2025, we hosted Know Your Rights and Family Preparedness workshops right after service or right after Mass. We would bring in attorneys and nonprofits who would give the information. We also did employer Know Your Rights training sessions. So really, again, through information, empowering employers, being prepared for an I-9 audit, what to do if ICE shows up to your establishments, marking your private and public areas. And then we also host a monthly immigrant service providers network with over 40 different nonprofits throughout the county, to just stay informed as the continued federal changes occur. The second part of the initiative is response and response activation. So the funds that were allocated to this were $300,000 total. And so we partnered with the Community Foundation of Anne Arundel County, and the foundation is the entity that actually administers the grant application and administer the funds to nonprofits that apply. Either in the legal services or crisis support services. This also established a donation fund, so anyone that would like to donate can donate to that fund, and the funds go directly to the nonprofits on the ground providing services. And the third part, and I really believe the only reason why any of this is possible, is through partnerships and coalition building. As I mentioned before, we're a small team, and so there's just no way that two people could do any of this by ourselves. And so we really leaned on different partners, different nonprofits, churches, volunteers, sometimes just residents who are looking to help. And that can look like assisting with some case management, canvassing businesses that we did this past weekend in Brooklyn Park, actually, and our family preparedness workshops, food deliveries, and advocacy. This is the hotline card, and this is the hotline number. Both myself and two other team members answer this line. And so the idea with having one phone number is to try as much as possible to have equitable access. So you don't have to know a nonprofit, you don't have to have uh, an existing relationship with them to get access to either information or services. The criteria really is your county resident, and to receive an actual service, you've been negatively impacted by immigration enforcement. And those services look like immigration legal assistance, access to mental health providers, which when Dr. Gomez reached out, this was something where I was like, yes, this is a big thing that we're seeing. And so we have kind of like a pilot program with a nonprofit, and we're still looking for more mental health providers that are trauma informed to join. And it's kind of like a pay scale, a sliding scale approach. But one thing that's really stood out is an increase in mental health support requests from the men whose spouse is removed and now is not only having to confront with, their spouse being just sort of disappeared in a matter of just a day, but then taking care of young children, more economic pressures, more home pressures, and really looking for assistance in a way that even during COVID, we didn't see when people were losing loved ones because they were passing away. And just a snapshot here of the calls that we received in our hotline. We saw a huge uptick in January. We saw more ICE activity, but we also continue to just try as much as possible to canvas. And so really trying to get the number out there, and relying on our partners to get the information out there that people can call. And then I wanted to flag two initiatives that we partner with other like community grassroots organizations on. One is Familias Unidas, which is a food delivery program. We do that through GoFundMe to raise funds. And then we have a sign up for volunteers that want to deliver food to families that have been negatively impacted. Um, if you know a family that could use that resource, we don't really ask questions. They can call the hotline and ask to be added, and they'll receive that service for 3 months to kind of get that family out of a crisis and stabilize them. And then we provide the local food pantry information as well. And obviously, if there is a big need still, if we have the ability to keep that family on there, we will. The second thing is Anne Arundel Rapid Response Network, which is a completely grassroots community organization that looks to verify if it's ICE or if it's local law enforcement. And that piece is really important because there are a lot of rumors that get spread really quickly on social media. And so, as much as possible, if you can dispel myths, that's important. And then, too often, based on those reports and people going out to take pictures or pictures that we receive through the hotline, um, family members see that on Facebook and are able to determine that their loved one's been detained that day. I also share this list of access points for different jurisdictions. We do get calls from other counties, and as much as possible, we try to connect them. But I share this because I know people are connected and don't live by the boundaries of counties, and so I wanted to just share other resources in neighboring jurisdictions. And then this one is the resources that our health department has as it relates to mental health. They have a family service line, recovery for folks who are out of a clinic and needing some ongoing support to combat addiction, and just different services that the health department has set up specifically around mental health in the county. This is not from OMA, this is the health department. So I just want to make that clear. And the health department also has a program called REACH, which is assist uninsured or underinsured residents get access to low-cost healthcare. Um, as we all know, healthcare in this country, unfortunately, is for sale. And so a lot of residents who maybe have coverage are still having to go out of pocket at such a high number that they just can't afford it. And so this program that the health department has partners with local hospitals and doctors to provide a sliding scale fee for services that residents are responsible to pay for, but the health department coordinates and does an intake process and attracts those health providers. The program is currently at capacity, unfortunately. That being said, they do make exceptions based on emergency situations. We know of a situation where someone had a tumor and it was sort of a life-death situation, and they made some exceptions so that person could get the care that they desperately needed. The health department also has, through their Office of Health and Equity and Racial Justice, their Community Ambassadors program has been going on for a couple years now. I can't remember the total amount of money they have, but I know it's a pretty large fund that they give to nonprofit organizations to really get information out there in different communities around mental health, different resources and services that the county health department in particular offers. And then there's the crisis warm line that's available 24/7 for any mental health or substance abuse cases the residents can call. And why are we doing all of this around the Family Protection Initiative? What we've seen over the past year is that ICE does not make our community safer. If anything, it has terrorized our communities. And we continue to see investments at historical levels. And so it's become more evident now more than ever why local government has to step up and be that safety net when the federal government has refused to. And if you take anything away from this presentation, um, it is that ICE's rhetoric and the rhetoric coming from the federal government that these are all criminals and these are, the worst of the worst is just not true. And it's not true by their own data. 5% of the people who are currently in detention have violent crimes. 5%. Over 70% have no convictions. And then you see the breakdown of other like traffic violations, immigration, which can be a second re-entry. But it's, oftentimes whoever has power controls the narrative of communities. And it's really important to look at the numbers so that we can all make the decision if this is actually what is happening or not. Or is it an effort to just create more division and more hatred towards a segment of the population who's currently being targeted by the federal government? um, and I shared at the beginning a story of a young mom over the summer in particular. We saw just like a way an uptick in children witnessing their parents being removed, kidnapped from their home. They're out of school. And one in particular, we received ring footage of a dad leaving for work in the morning, going to his car, and then mass agents surrounding the vehicle and like arresting him, and his children running out of the house to go and try to negotiate with the ICE agents, saying to take them instead because their dad was a hardworking, good person and that the ICE agents should just take the children instead. And then the kids coming back devastated and crying. And these children, after months, the person who's in charge of them or looking after them, um, sharing that these kids are showing signs of PTSD. And it's really important to think about what that impact will be for all of us in the long term. Um, there's a psychologist who compared the trauma that children as a collective are experiencing right now because of this fear is very different than when a natural disaster occurs. When a hurricane starts, there's a clear start and there's a clear end. So you can start the recovery period. This doesn't have that, right? Even if you haven't been directly impacted, if your parents haven't been detained, if you're afraid that that may happen to them or to yourself, you're in a constant hypervigilant state, and that can have very lasting impacts, especially for children. And so, just something to think about in terms of the mental health support kids need to be getting, either individually, but also as a collective as well. Um, and barriers, unlike a criminal court, immigrants don't have a right to an appointed counsel. And immigration law is the second most difficult type of law to navigate. The first is tax law. And so it's not reasonable to believe that a 5-year-old could go before a judge and make a case for themselves without proper representation. Our institutions are already at capacity oftentimes, like our social services, our teachers, and so they could not really handle a huge influx in demand for these types of services. And immigrants are often essential, I think, and usually are not eligible for a lot of the services that are out there. It's just additional data on why representation matters. When you go before a judge, your chances of winning your case go up exponentially when you have an attorney versus when you don't. And when a breadwinner is removed from the household, that family runs the risk of falling into a deeper poverty. And that's oftentimes what we're seeing more and more of. Right now, we've seen the targeting a lot of men who are going to work. And so if you remove the breadwinner, mom may be working, but she may not be make as much as maybe dad made. And so now they can't afford rent, they can't put food on the table, and the whole family is going down a crisis. And some stats about the county. I think the one that really here couple over 65% of our immigrant residents in the county have been part of our communities for over 10 years. So these are folks who have been here for a long time. And 1 out of 5 children in our school system would be negatively impacted by the current immigration enforcement tactics that we're seeing. And I talked about how this initiative works and the challenges we've had with raising private funds. I think like everyone, it's like we're only in March and it feels like we've been in this year for over a year now because there's so much constant changes and needs and crisis. So that type of landscape makes it, the resources very thin. And so there's a huge need in a lot of different spaces. And this is our QR code, which takes you to the donate portal of the Community Foundation, a QR code for volunteering. We have a huge need for folks to get trained up in standby guardianship to help families complete those forms. And so we hope to do kind of a volunteer day either at the end of March or beginning of April to get those types of workshops going. Thank you. And that is my last slide there. Hopefully I didn't go over.
You did great. That
Thank
was
you.
wonderful. Thank you. That's so useful. And there's so many points of overlap. I almost don't know where to start. I know that President Wadi is going to have a lot to share about. beginning with the fact that he's a lawyer, so we have a good deal to sort of flesh out here and discuss. But let me first give you a little bit of context because I don't know if I elaborated on how I came to know of your work. Um, about a year ago, I was doing my typical patient care, and I came across the executive director of the National Alliance for Mental Illness here in Anne Arundel County, NAMI. Happened to come into the space, and I was sharing with him, my his name is Fred Delp, and I said, listen, I am very passionate about raising awareness around mental illness, particularly in the Black and Latino community, not just because marginalized communities in general are put upon, but because these particular communities have been so ignored and in the recent past so under duress as a result of the rhetoric that you alluded to, which is very expansive, very deliberate, and quite elaborate. We can get into that at another point if we have time. But the beginning point is that Rebecca Haas, through the library system here in Anne Arundel County, was helping us brainstorm ways to connect with the Latino community and letting them know about services that were available at NAMI. And why am I starting off with that, even though this is a health committee meeting for NAACP, is that I serve on the board of NAMI for the county. The reason why it immediately made sense to invite you to this meeting is because we have the same struggle in connecting with the Latino community within the NAACP. And the NAACP's mission, although often misunderstood to be pretty one-sidedly about Black Americans, it has always been about an inclusionary view of all marginalized people and the right of all people to thrive and succeed in this country and have an equal shot at due process, which clearly immigrants have been, the government has, federal government has been very clear to illustrate that they're not entitled to, which I have taken a great amount of issue with and have, authored several essays on behalf of calling this to attention because it's entirely inconsistent with the concept of and the mission that's at least put forward as our Constitution. So the rights of individuals that come to this country are not insignificant, and they're not, as you pointed out already, automatically criminal just because they're seeking a better life in a new country, whether they're under duress from cartels and route, or even within our border, is another issue altogether. The right to dignity and a due process should be granted to all individuals. That's my take on how we should be interpreting our Constitution. And it makes no more sense to consider that a 5-year-old would be able to defend themselves when we fully know that a 45-year-old, fully fluent in English, can't really represent themselves in a court of law and be really have the full weight of the law protect their rights in this country. So it's irrational that there wouldn't be representation. So that, in a way, to conceptualize or contextualize how you came to be invited to help us move things forward within the NAACP. Before I even say more about how that can happen, let me also share with you, which I started to, that a lot of the points that you bring up or my impetus for putting a manuscript together for publication on the converging crisis of depression, suicide in the immigrant Latino community, in particular men, as breadwinners for the reasons that you point out. The stressors, the disconnection from their cultural origin, the difficulty in being the adult breadwinner who is trying to make a life for their children and give them opportunities at the same time that they are not self-investing in either mental care and our, because of our particular culture. I say our because I am Afro-Latino and an immigrant from Cuba in the early 60s. So I witnessed this firsthand. The ways in which immigrant men are limited in being able to handle these types of stressors and these odd contexts of trying to make a living and trying to accomplish citizenship status, full citizenship status, and at the same time provide for their families, deal with margination, deal with stressors in a society that devalues them and marginates them. All of these things lead to maladaptive coping strategies, mostly obviated when there's issues of violence and or drugs or alcohol involved. But this is the more likely propensity whenever you have these types of no way out, no one else to fend for yourself, no way else to fend for yourself, go figure it out. And this is just not reasonable. So we have these increases in suicide and depression and a lack of awareness to reach out to mental health services, whether they're low cost or lower cost or free, as they are often through many of the mechanisms in NAMI. They're still not the kind of services that are this Latino culture would immediately, especially grown men, reach out to for a variety of these issues that that I just touched on. I'm not going to go further into the details of all of that because it's really complicated too, but just to point out that my investment in this is large as well, and that I am trying to, through my work, push that forward as a physician, as a public health physician. And that publication will come out in the Journal of the National Hispanic Medical Association nationally, so that many of our colleagues, especially in the Latino community, can become aware and reach out to communities and help. Now, now I'm going to let Mr. Wadi help give us a little bit more context about the challenge that we have with regard to connecting all of these dots and, in particular, viewing your office as I think you were very sensitive about immediately communicating to me that it's a multicultural office. It's not the Latino office of multicultural affairs, and that our work really should be collaborative, not divisive, which is often a challenge that I have experienced here for the last 15, 16 years that I've been in the county. I relocated here essentially from New York City. And this experience has been really just eye-opening because the communities inside of New York City evolved in a different way. So Latino and Black communities have a different trust level and a different commonality, so that there are many areas, for instance, AOC, a lot of folks that are prominent in politics are driven there not just by the Latino community, but by the Black community as well, and other minoritized communities or marginalized communities that see themselves as New Yorkers first, community, and having a collaborative vested interest, which is not the case here. So,
I have a lot of thoughts on that on that too, but maybe for another time, because I think, like, I grew up in Prince George's County where it's Black brown, and so a different context in terms of me growing up like that. And then Anne Arundel County is very siloed off. I also though think it's important to remember New York City is or New York is Puerto Ricans and Dominicans
Yes,
had the
very different
Dominicans 2000 and Puerto Ricans are US citizens, so there's a different thing, but that
for sure.
that coalition building that has happened in New York, Chicago, LA hasn't really occurred here in the DMV for I think a variety of different reasons, but something that's super important.
Yep, yep. Steve, you want to help us out with
I was just
your
I would thank you for everything that you said because it's definitely is helps to contextualize a lot of the conversation. And while you were talking, I was looking up the resolutions that the NAACP has passed at the national level around having a comprehensive immigration reform. Been on the side of inclusivity, making sure that the debate around immigration reform was open. And then more recently, last year, we called for the abolition of ICE, called for the demasking or unmasking of ICE agents in our last resolution that we had on ICE. So it's something that the NAACP also is very much in favor of in terms of trying to make sure family reunification, because I think back in 2018 we passed the resolution around family reunification, which was the issue that I think sparked a lot of concern for a lot of people during the first Trump administration. My own uh, I listened to one of the senators from the Northwest. I can't remember, or Midwest. Excuse me. He was a Democratic senator they were debating family reunification when President Obama was president, and they described a situation exactly as you stated in your opening around people fleeing violence. Um, and I think from my own perspective, I try to for when I'm talking to people, I try to break it down to uh my family fled Baltimore, you know, because my father got robbed twice on Garrison Boulevard and said, I'm leaving. You know, he said he's grown up all his life in Baltimore City. And it's not his first time ever being, a victim of violence in the city, but at the same time, he was able to leave and Columbia became the place that he was able to take his family. That's where I grew up in Columbia, and I try to put that example out there for a lot of people to say, have you ever had to switch neighborhoods because kids were getting killed in that neighborhood? And a lot of Baltimoreans can understand that. A lot of people in this area can understand that level of like granular safety, the understanding of personal safety. And then, uh, but what we don't see is where there's a there's the borderline, and there's a stop at the border, between Baltimore and Howard County. There's a stop at the border between Howard County and Anne Arundel County. We don't see that because we can travel so freely. We have that freedom of movement. However, I do try to take it back to African Americans understanding we didn't always have that freedom of movement. And so, this is a legacy of something that, we all have in our DNA as African Americans, is that, Black Americans, we have to understand the freedom of movement, that nobody's illegal, no human being is illegal, and that crossing these borders for freedom and safety and economic freedom, being free from economic violence is just as important as being free from physical violence. So, I mean, those are just some of the aspects that I try to bring to the context of immigration to America, no matter where you're coming from. But in terms of what you were saying about NAMI and people accessing mental health, is that I saw that it was not free. It's a $5 fee for the for residents in Anne Arundel County. And
You're asking me or you're
no, no,
asking
no,
Allison?
Alice,
Because
Allison.
they're two different things. Not
No, no,
NAMI
no.
is
I was
not
I
the
was
same.
asking about Allison's
Okay,
presentation.
so
And
Allison's
yeah,
different than that's not NAMI. That's different. Okay.
right, right.
Hmm.
Sorry, you're right. I did put them together. I appreciate you. But yeah, where are the locations that Anne Arundel County mental health services are offered for anybody, but especially people who are experiencing this type of PTSD.
Hmm. So the ones in the intake, in that I think that's the one where the $5 is. That's a pilot program that we have with private mental health providers. We're currently looking for more, and I'll share that link afterwards.
Okay.
So if you know anyone, please encourage them to just like fill it out, and we'll reach out to them. Really looking for providers that are trauma informed, have experience working with immigrants communities and have different language abilities. Um, they provide sessions either virtual or in person. And the $5 is more so symbolic, just so that the resident will attend the session. Sometimes when it's free, some providers express concern that some people may not show up. And so there's a $5 sort of buy-in. It kind of ensures that that person attends. And then the nonprofit covers $100 per session, up to 12 sessions for each individual. And we've seen a lot of children needing support increasing, and I'm really concerned about what that looks like a year from now as well, because this is a pilot program, so it has, limited resources. And then for adults, we've seen men requesting this support as well, which um, is new. Oftentimes mental health is very much stigmatized in our community. And immigrant community is not something you really talk about, because then, people are like, oh, you're crazy, or you keep it sort of, you want to have this facade, right? You want to appear one way and you really keep it inside the family or sweep it under the rug. But that has really stood out to me as someone who worked in COVID in Prince George's County, and people were losing their wife, for example, who they'd been married to for 45 years, and we were like, do you need, some support? Like, this is a lot. And it would get turned down. And so now to have men requesting that support feels like something that we all need to pay attention to.
So I'll say two things to that, real briefly. One, that although this changes with younger generations, the older generation of men are very reticent to ever admit a need for help. The position of a very stoic and macho view isn't just the toxic masculinity conceptualization, but rather one of pride and self-sufficiency. So there, we are often not seeing ourselves as uh, as in need of help, but rather proving that our worth is tied up in not needing to ask for help. So it's quite a bridge to change that. Luckily, I think, especially with younger folks, that's changing, and that's great. But just to give some context of that. The other thing I'll say is that the warm line that you're describing is one option, but I want to just add into our discussion that the 988 line, which is a national line, and all you have to do is dial 988, is bilingual line. It's a for prevention of suicide and crisis, and it's available in English and Spanish, fully bilingual, 24/7. There's also a 24/7 community warm line, 410-768-5522. And these are available here in the county as well. And
I
I
have
think,
one,
go ahead.
Uh, are you seeing in the school system any changes? We signed a petition a few weeks ago around the school system, how the school system may be reacting to ICE. Have you seen anything in terms of like attendance or enrollment, and then help for students in school?
It's an ongoing conversation. I think certain things, the school system is doing their best to be responsive. And then I think other things, like it's new for a huge organization like the school system to think of like the federal government harming actively the children and how that requires a different type of response and support. Um, so those are ongoing conversations. I do think that there is a need for all children to receive more support around what's happening and how to process what's happening. Um, because that can lead to, bad behavior. It can appear in different ways, and then kids get criminalized for that when they're already dealing with these other things. And so I think there is opportunity there to continue to evaluate. And I think tapping into like resources like NAMI and just like how can we make that more trusted and known in different communities so that people take advantage of those resources. Um, and figuring out a way that children that have been both impacted or potentially impacted and maybe not impacted have a safe space to talk about what's going on because it's a lot.
And it's
And
also important, yeah. It's also important because we've had a couple of educators come to us for support on policies that are not really sort of far flung, but some folks are just not familiar with the idea that unless ICE has a judicial warrant, they are not allowed to just go into a classroom, go into administrative offices, go into staff room, go into bathrooms. They're not supposed to be on the premises unless they have a warrant. And so this is something that has to happen up front, and the leadership at the school has to help the staff understand that these things are, and this, by the way, this is the same kind of advice that we give at hospitals. And as an emergency physician, I see that more often than I see anything in the school. But it's the same idea. Unless there is a warrant for their coming on to the campus, they're not they have no place there. It's not for them.
Have we seen any ICE activity at the hospitals or in the area?
So we have had incidences where folks have shown up, and the staff that's aware will say, "Well, yeah, that person is here. They're a patient. Do you have a warrant?" That's a conversation. If you have a warrant, you have a warrant. If you don't have a warrant, you know, you can find another place and time.
mhm. We've also seen them hanging out around certain hospitals, particularly around Glen Burnie. So, it's intimidation tactics and opportunity. This isn't, an expansive operation of them trying to go after someone specific. This is just an opportunity thing and a numbers thing.
You
Um,
men- you mentioned Glen Burnie. After the shooting in Glen Burnie, how did your organization kind of respond to that?
Well, our county police is working with federal partners, particularly the FBI. Seems to be the only grown-up-ish entity right now on the ongoing investigation of what took place. From our side, from the office, we look at it kind of like a crisis response, and so the impacted residents and trying to get connected with them. Um, Neither were county residents, but we did do our best to get them connected to legal counsel. And so we know that the person who ICE originally lied and said that was in the car with the other gentleman and was not, he was already detained in their custody in their car. He has been released now as of probably 2 weeks ago. The other gentleman is facing criminal charges. But that was one of the things that, it felt, given the time of the year, right? It was like right in the middle of like the holidays. And
I think it
just
was
all of it.
the
It was
Christmas
Christmas
Eve.
Day. It was
Yeah, it
Christmas
was
Eve.
Yep,
right.
Christmas Eve.
Yeah, Christmas
Um,
Eve. Awful.
didn't get as much attention as I think it needed to get because it was a shooting and it was it seems like some of the enforcement we've seen in Glen Burnie is profiling people leaving like Home Depots and then just following them and trying to pull them over. So um yeah, so we respond to the human sort of family part and try to get them connected to resources as soon as we can.
Yeah, and it wouldn't be the first time that a car is just accelerating away from the ICE agents and they shoot into the car. So,
Wow. Yeah.
yeah, I mean that's basically what happened in a couple other places. So, anyway, um, we can't quite solve everything, and we're kind of coming to the end of our time. I do like the willingness to engage. I think we need to further have some kind of another forum for dialogue on how we can connect those dots. Because just because the situation of how the communities have evolved very distinctly from major cities like New York, Chicago, um, all the ones you mentioned before. It can't reach an impasse where we have no way out. There has to be ways out. Also, because there's no small number of Latinos that are Black. So I found myself in that conundrum my entire life, asking to pick sides, and I find this a perfect opportunity to illustrate that you cannot very often pick any side. And what happens is that engenders distrust with which I have spoken to Mr. Wadi about in the past. The big concern that I have is what happens to someone like me, who is a Latino immigrant, naturalized citizen in the United States of America, who wants to tell, hey, my community, we need to stand up for, oh, wait, you don't consider me part of the other community. Well, why not? So that's a learning curve that needs to be addressed here as well.
Yeah, 100%. And I think there is a need for learning our own history because very intentionally, um, people who have migrated have not learned sometimes even like the true causes of why they've migrated and how, whether it was U.S. intervention, which was the case for my parents and why they fled here during a civil war. Um, people have been lied to or have not been informed of their own history. And I think that learning your own history and realizing like you being here, like me being here is actually a resistance and like actually it's a celebration because my ancestors somehow managed to survive situations that were really meant to destroy them. Until I understand that, it becomes difficult for me to connect with others because there's been so many, whether it's lack of education systems or intentional efforts to erase history or rewrite it. Um, people can't connect the dots of this bigger thing, and but when they do, I do think that the bridge to then understand others and really empathize and understand the collective power there is instead of thinking that it's, against or how we try to just segment ourselves or society tries to segment ourselves and tells us to do that. Um, I think there is work to do there. I mean, that's why the community building mini grant is really meant to expose people to different cultures and to tell that story. But I would love to continue this conversation around storytelling and including history and just making it like connecting it in like real time as well for people. I
So,
think
so please
mhm.
forward the events and the dates, and let's see if we can figure out how to get representatives from both NAACP and NAMI at the event, so that we show up at the same place, at the same time.
That
Sound
sounds
good?
great. Yep.
Steve, did you have anything else to add? Because we're
Just
at time.
just to say that I know coming up at the end of May, we're gonna have an event. It's gonna be like a film fest that brings these communities together around the proximity to Blackness and the Black and Latino community, Black Caribbean community, having that proximity to how we all have come together in a diasporic way. And
That sounds like a great
that.
venue to use as a launch point, and have folks maybe sit at a desk or set up a table and create dialogue, and also in ways into the various groups,
Funded
support
by the
groups.
Office of Multiculturalism. It's the film fest. It's
Excellent.
yep.
I love film. All right, man. Thank you both for taking the time to do this. Thank you very much, Allison, for taking us through how the office is working. And I look forward to other times when we can overlap. Maybe the one in May is a great start. And let's just keep the lines of communication open to invite each other to events so that we all show up at the same place at the same time.
Wonderful. Thank you so much.
Thank
All
you,
right.
Dr. Gomez.
Yeah, man. Thank you.
I
You guys have a
appreciate it.
good night, and get some food and rest. And thanks for taking the time to do this.
Thank you, Director.
Thank you. Thank you so much, President.
Have a good
Have a good
one.
night, everyone. Bye.
Good night.